Good afternoon, I'm Dr. Urangi. Well, this is my clinic. Fortunately, I can meet you. Are you enjoying staying in Korea? Yes, yes, I hope so. Well, I've been thread lifting, I performed thread lifting for almost 20 years. And I've also collaborated with ALFA Medical for several years. But because of the COVID, we couldn't meet for a long time. So finally we could meet, we can meet. Welcome again. And nice meeting you. So today I'd like to share some information and the detailed information about their products. Even though I cannot speak English so well, but I will try to speak slowly. Let's get a glance about the information of these products. Okay, let's start. I will deal with the application of thread on face. Today, I'd like to tell you 5 topics. The first one, thin thread. Second, thick thread. Then node thread, scaffold type thread. Finally, we will deal with the materials for lifting thread. The first one, thin thread. I believe that all of you are using thread. Is there any doctors who've never used the thread yet? Could you raise your hand? No. Yeah, I see. So the thread is developing very fast. The best way for a physician to follow or to perform the sophisticated procedure is to follow the trend of new products. So we should know and we should learn about new products. Sorry. This is mono thread. I don't have to explain about this because we are using this all day. As we know, it's very simple, but it's very useful. But we have a lot of developed thread nowadays, but the effect of this thread is very limited. And as we know, it's also loaded on a shaft needle. Okay. First of all, it seems to be too formal. You don't have to. Let's be casual. It's like a formal conference. So let's be casual more. Okay? Yes. Then if I get the effect with the mono thread, I should insert at least 100 thread on patient's face. Then what will happen? The patient will be a hedgehog. Yes. So I should insert so many needles on patient's face. It will cause swelling, bleeding, bruising. It takes several weeks to be recovered from it. Then how the patient will go back to your clinic for next procedure? That's the problem. Yes. But the effect is not so clear. Yes, not satisfied well. So how can we improve our procedure with the mono thread? In this case, is it okay? Can you see me? Yeah. If we use more developed type of thread, like screw or double screw, we can reduce the number by half. We can only use 50 thread, it's okay. But still, it's too many. Then how can you do? Yes, more advanced one. That's Cogging Screw Plus. If we use this advanced thread, you can reduce the number and the patient don't have to be suffer from the swelling, bruising. This is the Cogging Screw Plus. Again, Cogging Screw Plus thread. It's like screw thread. Outside of the needle, the thin thread is loaded spirally. But as we can observe, there is a tiny cutting cog on the shaft of the thread. Inside of the needle, it has bidirectional cutting cog. Let's talk about bidirectional later. Anyway, it has 2 effects. The first one, originally, thread itself can stimulate surrounding tissue to synthesize new collagen. Second, the cog can physically pull the tissue. These two effects can make a better result. So actually there's two types, Cog Screw. Actually I prefer using Cogging Screw Plus. But even though it's slightly expensive, but it's better. I can reduce the number anyway. So there's a tiny cutting cog here. It's very useful. And it's a thin thread. Let's talk about the unit of thickness here. We are usually using the unit of USP. With the PDO, the 7O is the thinnest thread. 6O is thicker than 7O, 5O, 4O, 3O, 2O, 1O, then 0. Then number 1, number 2, number 3. With the PDO, the number 3 is the thickest thread. So it's not, till now it's not used for human body, it's used for horses or cows. But nowadays we are using the number 3 thread as well for lifting thread. This thread is 6O, very thin. So to inserting this thread is not so invasive. It's very simple, even for the physicians. To insert this thread is also very simple. Just insert the thread. Pushing the white styrofoam brake, you can remove the needle softly. Pull the exposed part a little bit more and cut it off, pressing the skin with the scissors. So you can also restore the dimpling with mild rubbing. Very simple. This is an example of application. I use almost 24 threads to correct the whole face. Very simple. It takes about 5 minutes. But don't forget, when you remove the needle, you should press that area to prevent bruising or bleeding. It's very important. Anyway, we should reduce the side effect because your patient cannot stand the bruising or swelling. That's a very important point. I applied only Cogging Screw Plus thread on this lady, so we could observe the improvement on her lower face. Let's go on. But as we know, the thin thread is not enough to satisfy the patient's expectation. Some people think that they expect some result much better than that of surgery, but it's really hard with thread. But anyway, they want it, so we should develop our procedure. That's why they invent this kind of thread. It's thick, about USP 1O, 2O, sometimes it's number 3, very thick. It also has a cog, which can anchor the tissue. First, we will deal with the cutting cog. It's also the same with Cogging Screw Plus. They cut the thread oblique to create a cog. This cog will anchor the tissue. It's designed bidirectionally. On this part, the cog points out this way. On the other part, the opposite. This is bidirectional. How can it work? First, we insert the thread on tissue. Then if we pull the thread bilaterally, it will slide. But when I release the thread, it will go back with catching the tissue. The middle part of the tissue will be corrected, shortened. But if I apply this vertically, it means lifting. Do you understand this? Yes. I can also apply this on cannula model. First, I will stand here. I insert the thread in this way and remove the cannula. The cog is exposed to the tissue. If I pull the thread here, this part will slide, but this part will resist it, or catching the tissue together. Finally, the middle portion will be corrected, shortened. That's the mechanism of thick thread. But as we know, the cutting cog is very weak. The cog can be easily damaged, or it can be easily cut because it has weakened point on the shaft. So they finally found a stronger thread like a Sculpted Cog. The commercial name of ALFA Medical for cutting cog is Cog Pro. Is there any doctors who are using Cog Pro here? Maybe the name must be not familiar yet, but the Sculpted Cog in ALFA Medical is Cog Master Gear 1 or 4. Cog Master Gear, the most important word in today's presentation, Cog Master Gear. They, with 1/4 thick thread, they sculpt out useless part to create undamaged main stem and big and strong cog. So there is no damage on main stem, different from the cutting cog. It can catch more tissue, it cannot be easily cut. It's also designed bilaterally loaded on a cannula. So actually it's an L-type cannula. I will talk about the cannula type later. So you can insert the thread and remove it. Only the thread will remain into the tissue. Then you can pull a little bit more and cut it off. Very simple. But it's still insufficient. You know, as time goes by, patient wants more strong, better. So finally, this Sculpted Cog is not enough. That's why they invent a new one, the negative cog. It looks okay. They punched out this portion to create a cog. This thread is really thick as number 3, the thickest one, very thick. So even though it's weakened point here, but it cannot be easily cut. This big portion can be a cog. They can catch this big tissue. It's really potent. The cannula is slightly different. I will talk about the cannula later. Anyway, so this is Cog Master Gear 3 or 6. To memorize the names of model is very important. When you choose the correct thread one you want. Again. So let's talk about the cannula. These threads are very thick. Usually these threads are loaded on a 18 gauge or 19 gauge needle. It's as thick as a straw. So if I insert this 6 needle into patient's face, what will happen? It's like a stepping with a chopstick, too thick. So it can cause bleeding. It can also obliterate some important structures like nerve, muscle, sometimes gland. It causes a lot of problems. So to reduce this kind of collateral damage, they invent blunt needle. But still, it also causes a lot of side effects. That's why they use cannula instead of the needle. But the R-type cannula, with R-type cannula, the cog can usually stuck here. So they denuded it. The L-type cannula, there's no portion like R-type. R means the regular, L means but the shape of this cannula looks like letter L. But still, the effects of the L-type is quite sharp. It can also cut the tissue as well. Finally, they invent W-type cannula. But the tip is too blunt. You feel resistance when you insert it. The most advanced type of cannula is WA-type cannula. So they tried a lot. So maybe the competition in this market is very hard in Korea. Finally, with Cog Master Gear, there is two types of thread, two types of the cannula, L type and WA type. So you should know the difference. I prefer WA type because it's most advanced one. So let's summarize. Cog Master Gear 1 and 4 used the sculpted thread. It also has the blue model and white model. Blue is PDO, white is PLACL. I will talk about this material later. And Cog Master Gear 1 is loaded on a L-type cannula. 4 is loaded on WA-type cannula. 1 and 4, both 1 and 4 are sculpted cog. Cog Master Gear 3 and 6 are negative cog. They also have two models, PDO and PLACL. Blue is PDO, the white one is PLACL. Cog Master Gear 3 is loaded on L-type cannula, 6 is loaded on WA-type cannula. So it's very important. You can, this is an example of application. I'd like to correct the nasonavial fold partially, and I want to improve the lateral control of our lower face with this thick thread. You can use any kind of thread for this procedure. Cog Pro okay, but it's quite weak. You can also use Cog Master Gear 1, 3, 4, 6. Everything's okay. You can choose one you want, depending on patient's condition or your preference. First, you can make a line from the lateral canthus to earlobe, and then you can make 4 points on it. On medial 2 point, you can insert the thread oblique laterally to temporal area. With this thread, you can pull the tissue around here, which can also improve nasolabial fold partially, and the mid-cheek. You can also improve the appearance of the mid-cheek as well. You can insert the 2 more threads on the lateral 2 point. You can advance it straight upward. It can also improve the drooping around the mandible angle and lower face. But furthermore, to correct the jowl around here, you can insert 1 more thread from the hairline around here to the jowl directly, and I can insert 1 more thread from side bone to the jowl. Then you can pull them up together to correct the jowl. It's very useful, and the irregularity on the surface area is very limited. It's very useful, but it has some cons, drawback, because if you apply this procedure for the patient who have wide lateral malar, it will aggravate it downward. Insert 2 more threads to the lateral part of the marionette line to correct the jowl. Simple. Yeah. But once you've accumulated the experience with thick thread, for better fixation, you can tie them together. Don't forget to bury the knots into the skin. So if you insert 2 threads into 1 skin hole, you can tie them together and bury the knots and cut the exposed part for better fixation. The medial correction is also very important. Usually, jowl and nasolabial fold can be the target area. I can insert 2 threads from the jowl to medial canthus, another 2 threads from the jowl to lateral canthus. The dimpling should be released with mild loving. So, but we should know this. It's very important. there are a lot of facial expression muscle on medial face. Actually, it's not mobile part, it's mobile part. If you insert thick thread on it, thick thread here, the patient will complain of discomfort. They complain of foreign body sensation. So you should choose thinner thread to reduce the complaint from patient. It's also very important. You should control the complaint of your patient. So I prefer 19 gauge cannula for this application. Furthermore, is there any plastic surgeon here? No? Plastic surgeon? No? Okay. So some people want some blepharoplasty, but other patients don't want because it's very invasive. For that people, in Korea, the Far East Asian has laterally slanted eyebrow, so it's quite different from Caucasian or Latin. So to correct the drooping on lateral eyebrow, you can insert the thread from the lateral eyebrow to hairline. You can insert the two more thread from the hairline to eyebrow. It's very famous with foxy eye. I'm sorry, foxy eye. So yes, foxy eye. Sorry, but Korean doesn't like this. Originally we have foxy eye. So actually in my country I should insert here and here as well together. The insertion is also usually the 6 thread is loaded on a cannula. You should make a puncture with an 18 gauge needle. 18 gauge needle and inserting the thread. When thread end reaches the targeted point, you should twist them 1 or 2 rounds to fix the thread end there. Then remove the cannula softly. Only thread will remain into the skin. Pulling and pressing with the scissor cut. Simple. Rubbing to restore the dimpling. Simple. But the layer is also important. It's not simple for the beginner, but if you succeed one time, it's very easy. If time permit, you can apply by yourself today. Furthermore, for better fixation, you can use a dual needle thread. It's a long bidirectional cog. At the both end of the thread, it has 10 centimeter long needle. But if you are a beginner, I do not recommend this. Once you should accumulate a lot of experience with fixed thread or loaded on cannula, then apply this. Because it's very strong, which means it can also cause some problems. To use this very fluently, you should solve the problems first. Second, there's 2 types of needle. There's 2 types, but it's not used anymore. It's too invasive. It can also cut some tissue. So I prefer a taper point type. U-shape, T-shape is not important. It's also applied for eyebrow correction, Korean style, Western style, different. It can be also used for the correction of lateral face as well. It can also be very useful to correct medial neck drooping. You can make a point here, insert 2 thread, 2 needle this way and this way. Pull the thread bilaterally. I applied a lot of dual needle thread and thick thread for this lady about 10 years ago. So I would like to share some important technical tip. It's not long, so there are 5 layers on the face. You may know that. The first, skin, then subcutaneous layer, SMAS, subcutaneous muscular open erecting system, SMAS, thin facial expression muscles, bluntous mass. Then space, it can be also called fat, deep fat or retaining ligament, some vacant area. Under it, there is fascia of deep muscle or periosteum, 5 layer. Which layer is the optimal for the inserting thread? Subcutaneous layer. If you are a beginner, you do better to stay at subcutaneous layer. Once you can accumulate a lot of experience, so you know you can deal with the side effect, you can go deeper. But if you're a beginner, please stay on subcutaneous layer. If you use a thin thread like Cogging Screw Plus or mono, you can insert it as superficial as possible, just under the dermis for better result. But with thick thread like Cog Pro, Cog Master Gear, you should insert it into deep subcutaneous layer. If you insert it too superficially, the contour will be exposed on the surface. One more thing, important structures like nerve, vessel, gland, duct are located under smooth layer. That's why I emphasize to insert the thread on subcutaneous layer because it's safe and easy to make a result. The parotid gland, that's okay. If you can meet some bleeding, just press there for a moment. It will disappear. Very simple. Sometimes, yes, I also get a consult from a lot of doctors from many other different countries. They commit parotid duct penetration. One of my friends, one of my Korean doctor who practice in Vietnam, typed me today. He sent an email. He penetrated parotid gland. What happened? Actually, nothing happened. Just to give them some antibiotics and said the result is not so severe as we expected. But anyway, you should be very cautious when you insert the thread around the territory of parotid gland. But once you once you commit some side effect, it's okay. It can be conservatively approached. Give them some medication, painkillers, and antibiotics. It will disappear day by day. Furthermore, the anesthesia is also very important. It's an invasive procedure. You can use ointment or local injection, tumescent solution, or in my case, I prefer to apply the IV sedation with propofol because in my operation is well equipped. But the propofol sometimes it can be very dangerous. I think the answer is tumescent solution. On inserting point, you can inject lidocaine first. Make a puncture with 18 gauge needle. You can infiltrate the tumescent solution with cannula. Long, thin cannula, 23 gauge, 7 centimeter. It's very useful. Anyway, without IV sedation, the patient will pain. To reduce pain is very important. To pursue them to get the procedure again. So, please use this tumescent solution. This lasman is quite different from that of live suction. It's stronger because it's very sensitive on the face. I add more lidocaine, 100 cc saline, 10 cc bicarbonate to reduce the acidic pain. 20 cc lidocaine, 1 cc epinephrine. Epinephrine is very useful to clot the vessel, which can reduce bleeding and bruising after the procedure. So let's move to the next contents. Nose thread. Different from the lifting thread. Lifting threads are shortening thread, but the nose thread is a lengthening thread. That's why the direction of a cog is the opposite. Once you extend the tissue, insert the thread will keep the extended distance. There's a two type. Visu 1 is for the elongation of the dojum. Visu 2 for use to elongation of columella. Usually in Korea, there are a lot of people to augment their nose. It's quite different. So with the filler, we can augment the nasal dojum, but it's very difficult to use filler to elongate our teeth because it's quite dangerous. But with the use, by the help of this thread, it's very easy. But in your case, you can correct tip drooping with this thread. It seems that there's a lot of tip drooping patients in your country. You can insert Visu 2 thread from the nasal tip to the nasolabial angle. You can correct it very simply. I can show you this procedure today. Furthermore, scaffold type thread. Actually, I can categorize the effect of thread lifting into two factors. The first one, the cog can bite or catch tissue physically. The second, the thread stimulates the surrounding tissue to synthesize new collagen. The scaffold type thread is designed to maximize the effect number 2, stimulating surrounding tissue to synthesize the new collagen. It's like a framework of building or net in the sea where the seaweed can gather. This is the first model of scaffold type thread, multi-line. It's 12 threads are loaded on a single cannula or a single needle. So if you insert one cannula, you can insert 12 mono thread. Very convenient. It can make a volume by the synthesis of the collagen. The second model is Cavern. It's a very tight spiral. Once you insert the thread and remove the needle, the collagen will grow into the gap between the thread. Finally, it can make some volume. It's very useful. The histological study in the Swain model also shows that there is a volume change because of the thread. We can restore volume with this thread. It can be used to correct the wrinkle mainly. I can apply the thread, the wrinkle for forehead and front line. But what is important is that we can inject the filler for the front line, but there is supratrochlear artery. If I inject the filler into that vessel, what will happen? Yes, blindness. So I'm really nervous and I don't want to inject filler there, but with the thread, totally different. Very simple, totally safe. The most serious complication with the thread is bruising. That's all. Very simple. I applied multi-thread on forehead wrinkle. Make a puncture with 18 gauge needle. I apply subcision with 18 gauge cannula to make space for the multi-line thread. I insert the multi-line thread. Very simple. The maximum volume will be established in a month. It takes time for collagen synthesis. I also insert cavern thread for the front line. Inserting the cavern thread along the wrinkle is tightly attached to the needle. By help of auxiliary tube, you can push it into the skin to separate the thread from the needle, push and remove this. Very simple. I prefer to use multi because it's less expensive. Actually, he's observing me. Sorry. Anyway, so the multi-thread is also used for restoration for the restoration of volume over hump. There's a depression around here. In the case of the hump nose patient, we can inject the pillar. Of course, we can inject pillar there, but it's also sometimes it's very dangerous and complicated. But if you insert the multi-line thread from the forehead, it's very easy to approach. I only use thread instead of pillar to correct this hump nose patient. I insert Visu 2 thread here and here to make a prominent nasal tip. Then I apply multi-line thread here to fill the depression over the hump.
Does it create volume in the labella?
You should insert a lot. A lot, maybe 4 or 5, which means about 40, 50 thread. So it can also make some volume in a month, not immediately. Yeah. So let's move to the next topic, the materials. Do you know what's the materials of lifting thread which is usually used in your clinic? Yes, PDO, polydioxanone. Polydioxanone is highly biocompatible. It's also resistant to the infection as well. It's really useful. It was a great material. First of all, this kind of thread lifting, the idea of thread lifting comes from the Russian doctor Shulamanich, but he used the polypropylene, which is not absorbable, which makes a lot of side effects. But with the PDO, no, it's very simple, less side effect. But as I mentioned before, the patients want more. The duration of PDO is about 6 months. It's relatively short. So they want some materials which goes further. The first candidate of the second lifting thread was PLLA, poly-L-lactic acid. But it's very hard. It can be broken or it can stick out easily. The patient will complain of pain after inserting it. So it also has very low plasticity. You cannot make a very complicated cog with this material. So the third candidate for lifting thread was PCl, polycaprolactone. It goes for more than 24 months, really long, but it's too flexible and too soft. It can be easily deformed during processing. It's really weak to heat. We cannot process it. Finally, they mix them together. Actually, it's called PLACL, the compounder of PLLA and PCl. It goes for at least 18 months, and the hardness is like that of PDO. It's very useful. It also has very high plasticity. There's a concentrates of two materials, PDO, PLLA, PACL, PLLACL. So finally, I recommend these materials. So fortunately, ALFA Medical succeeds to distribute the PLLACL, the thread lift, in all product line. It's very unique in the world. So you can use ferrulacia or many kinds of ferrulacia materials. But it's quite expensive. So in my case, I apply PDO thread mainly to get the duration effect. I can add some more ferrulacia thread. It seems to be the best way for me. Furthermore, I'd like to briefly introduce the new model, which is also called mesh cog. It's not certified yet. I heard that the certification is ongoing in your country. You can use this thread in a few years, I think. It's the combined foam with sculpted cog and scaffold type thread. Once the anchor of sculpted cog can bite the tissue, then the tissue will grows into the gap between this scaffold. Then the delayed anchoring failure will be prevented. So I do believe that this thread is the most advanced one yet. Okay, this is the end of my presentation. But let me recap today's presentation. The first, you should memorize the name of Cog Master Gear. Two types, sculpted cog type and negative cog type. So next time, if you want to satisfy your patient, you should order Cog Master Gear. And you should consider the material of ferrulacia for long duration. And there is a WA type cannula, which is less invasive yet. So I will show you the model. So could you tell me the name of the model? Okay. What's this?
Cogging Screw.
Cogging, strictly speaking, Cogging Screw Plus. Again, Cogging Screw Plus. Yeah, not so simple. Cog Master Gear 1. Yeah, Cog Master Gear, but it's loaded on a L-type cannula. That's Cog Master Gear 1. What's this?
Master Gear 3, 4,
6. Yes, loaded on a WA type cannula. Cog Master Gear 6. So yes, PDO, ferrulacia, you can choose. You can also choose L-type or WA type. What's this? Yeah, multi-line. Yeah, thank you. Cavern. Yeah, the Visu 1, Visu 2 for nose. Okay. So this is the end of my presentation. Thank you for listening. Thank you. Do you have any question about my presentation? You can ask freely. No? Oh, thank you. Thank you very much. So